tummy tuck, also known as abdominoplasty, is an operation to remove excess skin and fat from the abdominal area. There are various different types of tummy tuck depending on how much skin and fat we need to remove. So it might range from, say, a mini tummy tuck, where you remove a small ellipse of skin from the lower part of the tummy, all the way through to, say, a fleur-de-lis abdominoplasty, where we're taking out a big vertical wedge as well as a horizontal wedge in patients who have a lot of loose skin. So there's no real one tummy tuck. There's a sort of spectrum of operations that we do. Probably the most common tummy tuck, when you think about a tummy tuck, is removing the skin and fat between your tummy button and the pubic area, and that gives you a scar from hip to hip, usually then with a little scar around the tummy button as well. That's what would be called a standard tummy tuck or abdominoplasty. A lot of these operations nowadays are performed with liposuction as well, and sometimes with a skin tightening device as well. So those are the sort of more modern innovations with tummy tuck surgery, is to combine it with adjuncts like liposuction or skin tightening. So patients having tummy tuck surgery, I'd say the number one thing they have to do is not smoke. I think, as with any plastic or cosmetic surgery, we do not like operating on people who smoke, because it really plays havoc with wound healing and can cause serious complications. So definitely no smoking for at least 6 weeks before surgery. The other thing I would say is that people having tummy tuck surgery should maintain a stable weight before their surgery, and not decide to go on a sort of eating binge because they think they're going to have all the tummy fat removed. At the end of the day, tummy tuck surgery is only going to remove the skin and fat above the muscles. If you have a lot of fat around the organs internally, that's going to affect your abdominal contour, and it's not something that a plastic surgeon can reach doing the surgery. So to get the best results, no smoking and a nice stable weight preoperatively with a healthy, balanced diet. Yeah, so as I say, in terms of preparing for the surgery, maintain a nice, healthy, balanced diet, get your body in a position where the healing potential is maximized. So lots of, fresh fruit, vegetables. Don't try and, gain weight or lose weight. Some people think that they want to suddenly lose a lot of weight as well, and that's not recommended. Just maintain a nice, stable, balanced diet and healthy weight. We aim ideally for a BMI of around 30 or below, because patients with a high BMI, that's body mass index, are prone to more complications. So it's generally a safer and more predictable operation if it's done with your body mass index of around 30 or below. So those are the things really to do in preparation. Other than that, you need to look at your recovery. So if you need to sort of sort out childcare or get your friends or relatives involved to help you out in sort of first couple of weeks after surgery, that's always a good idea as well, and to think about taking time off work. Yeah, so in terms of recovery, I'd say there are several stages to recovery after a tummy tuck. The first is, your immediate stay in hospital, which is normally a couple of days. And then when you get home, it's going to be quite sore to move around and do things for at least a couple of weeks or so. Most people tend to go back to work, depending on what their job is, after about 3 or 4 weeks. And then I say that people can go back to the gym and doing more heavy activities after about 6 weeks. And then to finally fully recover in terms of for all the swelling to leave the body and the scars to settle down, that can take anything up to around 6 months. So there's various stages to go through with the surgery. And that's where we, as a surgeon, come in as well to reassure the patient if there are any problems or if there are any questions or concern, and just keep, remind people that this is a long-term process and it does take time for things to settle down.